But how could the entire medical profession be wrong about this? And I mean, in some ways that's a good point, but last night I decided to list 10 things which I think we could all agree on the medical profession in the last approximately 150 years or so apparently got wrong. So let me just read this. And by the way, people say, Tom, you should take notes and write things down for your talks. I did. See, I can't really read it because I can't read my own writing, but I did write it down. So in the 1870s, there was a treatment for schizophrenia run by the Quakers called moral therapy, where they basically took the worst of the schizophrenics and they put them in houses. And the rules were you had to take a hot bath and wear clean clothes. And the people had to eat 3 meals a day and the staff had to be nice to them. And they stayed there for about a year. And they reported in the medical literature something like a 60% or so remission rate. And it was a durable remission. In other words, they looked like they were cured. So anybody who wants to learn more about this, I would read the book Mad in America by a guy named Whitaker. Then eventually the psychiatrists took it over and they started doing their lobotomies and their chemotherapy. And as of now, their cure rate for schizophrenia is now about 0%. So that's one place. Even in the 1918 flu pandemic, there's probably many factors responsible for that. There's certainly the possibility of the radio wave new exposure. But another one was the advent of a medicine, which we all know, called aspirin, which was created by the Bayer company. And it was the new wonder drug, especially for treating flus. And many of the people, if not most of the people, died from hemorrhage or bleeding. And so they were giving people, the medical profession and just lay people, giving people 20 to 30 aspirins per day to treat the flu. Now, I think all of us realize that the main side effect from aspirin, especially an overdose like that, is bleeding or hemorrhage. So I'm sure that had something to do with it. And then we had the smoking, which was promoted for decades by the medical profession as something to calm your nerves. And then we go into x-raying of people's feet for fitting them for shoes. That was considered safe. And then we go into the thalidomide, which was a medicine used to treat morning sickness, which resulted in thousands of birth defects. Then we go into bone marrow transplants for treating breast cancer, which never worked. Then we did, which I talked about the last time, we had such a poor understanding of the microbiome that even when I was in medical school, we were still attempting to sterilize people's gut flora as a way to help them, which of course never worked. Then we move into treating women with estrogen, which now we know caused them to get breast cancer and uterine cancer. And then finally, we have the Vioxx debacle, which resulted in giving a headache medicine to people that resulted in at least 50,000 deaths, and some people say a lot more. And then the final one I'll say is even when I had to get my license in California, we were required to take a course or do an online program to learn how to prescribe opiates to people because we were told we were under-prescribing opiates. And now, I don't know how many years later, and I don't know how many deaths, we now have to take a course to maintain your license, teaching you how not to prescribe opiates because we realized we killed thousands, if not more people. So I'm sorry, I just can't buy the argument that just because this is conventional wisdom or the medical profession believes it, that means it must be true.